Clock ticks down to the start of a new year. A group of local pediatricians are weighing in on how to keep students healthy this year. Claire Kreitz joining us now in the studio. Claire, these doctors say it's important to get kids back in the classroom, but not without some precautions.
Yeah, that's right, Cassandra. The River Valley doctors wrote an open letter to all districts in that area. They are stressing how important in-person learning is for mental health, but they also don't want to see a huge spike of COVID cases when kids go back to school.
In just 1 week, students will fill the halls of schools across the state just as COVID-19 cases are on the rise.
We're not very confident. We're feeling very worried at the moment.
Dennis Freeman is a River Valley parent and is sending 4 kids back to the classroom. He worries about one of his children most of all, too young to get the vaccine.
Our youngest child, she has asthma. She's on the strongest medication we can get her on, Symbicort. So she's about a bad month away, if she ever gets really sick, from being on COPD medicine.
He understands the importance of in-person learning.
Of course, the kids miss being at school. They miss making friends. They miss seeing people.
But wonders at what cost.
You kind of have to make a decision. Is isolation worse for their mental health than being put on a ventilator?
For Millard Henry Clinic pediatrician Dr. Chad Masters,
the best place for the kids to be is in school.
He's seen the mental toll spending time behind a screen has taken on his young patients.
This was from elementary all the way up to high school. We saw increased cases of anxiety, depression, even suicidal ideations.
He says kids need that face-to-face interaction, but to keep kids in the classroom,
we're definitely seeing more symptomatic kids with COVID.
They need to follow some guidelines. Sending out this letter to all districts in the River Valley, local pediatricians are asking staff and students 12 and up to get the vaccine, and along with pens and pencils, add a mask to the school supply list.
We have seen evidence in our clinic visits that the precautions we took at the beginning of the pandemic seem to help at least reduce respiratory viruses.
For Freeman,
my children will be masked when they go.
He's hoping that isn't just his choice, but the requirement for all students and staff.
Trust the doctors, trust the medicine.
Right now, districts can decide whether or not to require masks for staff and students. So far, no district in the River Valley has made that announcement. Cassandra.